Good morning, good evening, good afternoon, good night, whatever time of day it is that you're watching this. I'm glad you took the time to watch it with us, okay? Today I'm going to go over a very simple topic, but it is one that there's a lot of confusion about. What is Medicare? If you're like a lot of Americans, you have probably had group coverage or something like that throughout your life and haven't had to worry as much about this portion, you know, of day-to-day life, healthcare, and how to manage your healthcare. And with Medicare, they kind of throw you to the wolves, where they're kicking you off of these group plans, or you're retiring and you're having to deal with it all of a sudden. And Medicare is kind of confusing too, so it can be a big challenge. Now, if you're self-employed and you've been dealing with health insurance, could be that Medicare is a big godsend from what you've been having to deal with. But we'll have to dive into that based on an individual basis. What I wanted to talk about today is just what is Medicare. So it's pretty simple. Medicare is the health care program for people who have certain disabilities or are age 65 or older. Now, a lot of confusion comes into the difference between Social Security and retirement and Medicare. Some people know now that they might have to be age 66 and 4 months to get full Social Security retirement, but that they don't have to wait until then to get Medicare. They can get Medicare at 65. Now, a lot of people are getting Social Security at 62, but if you retire at 62, you cannot get Medicare at that point unless you have one of those disabilities and get approved for Medicare through Social Security disability. Medicare comes in 4 parts. So just very briefly, I want to go over those 4 parts, okay? There are parts A, B, C, and D. And I'm not going to dive in deeply to each part, but I have additional videos in our Boomer playlist or throughout my channel talking about this, or on the website. There are plenty of articles that go into it. But you have Part A, B, C, and D. So those are the 4 parts, P-A-R-T-S. There are also plans, which is different, parts versus plans, okay? So remember that parts and plans are not the same. Part A is hospital coverage. This is room and board at a hospital. That's the easy way to think of it. Part A is also normally free for people who have paid at least 40 quarters of taxes into Social Security in their lifetime, or Medicare taxes. Part B, medical. This is covering 80% of almost everything else associated with Medicare. But you have an unlimited 20% co-insurance. Part A and B make up original or traditional Medicare. This is typically what's on a Medicare card once you go on Medicare fully and don't have other coverage. Part C is Medicare Advantage. Okay, Medicare Advantage has been around for a little while. Recently, in the last couple of years, it started getting advertised more heavily on television. But Medicare Advantage is a way to give a private insurance company the rights to administer your original Medicare benefits, and oftentimes loops in Part D with it, which is your drug coverage, okay? Now, Part C, Medicare Advantage, doesn't always have drug coverage, but it oftentimes does. So you have A, B, C, and D: hospital, medical, Medicare Advantage, and drug. That's the typical genetic makeup of the 4 parts of Medicare. Now, I want to take just a second to explain the plans. Okay, so with plans, you have Medicare Supplement plans. These are also known as Medigap plans, okay? It's the same thing. These are plans. They can be plans A through N. Most commonly Plan F, Plan G, and Plan N. And then also pretty commonly high deductible F or now high deductible G. Those are plans that attach themselves to your traditional Medicare and pay all of or the majority of or a portion of the expenses associated with Parts A and B of Medicare. Another type of plan would be Medicare Advantage plans, okay? Those are often referred to as plans. So a private insurance company is going to offer all of these, okay? Now, the confusing part on this is that Medicare Advantage is Part C because it was established as a part of Medicare, but Part C is always manifested as a private plan. So the big differentiation between parts and plans is that plans are offered by private companies. Parts are established by Medicare as a part of Medicare. The last plan would be drug plans. Same confusion here is Part D is the drug plan portion of Medicare. It's that part of Medicare, but private companies administer these drug plans. There is no Part D and Part C that you get directly from the government. It's outsourced to private companies. The only coverage that is actually coming from the government is Part A and B. That's the only thing that would actually be a part that is administered by the Center for Medicare Services directly. All the other portions, drug plans, Medicare Advantage plans, and Medicare supplements are administered by private insurance companies. And there are 50 or 60 of them in most states that offer some version of at least one of these plans. So that's kind of my general rundown on what Medicare is. If you need more information, you can call us, Bobby Brock Insurance. You can go to bobbybrockinsurance.com, look around, submit a request, or give us a call at 662-844-3300. And we would love to help you with it. We have about 100 combined years of experience, and we're often referred to as America's #1 Medicare brokerage. Thank you guys for watching today. We'll talk to you soon.